If I told you there's a specific spot on your body that you can press for just 2 minutes to dramatically enhance blood flow and restore the kind of firmness you haven't experienced in years, would you believe me? Most men walk past this spot every single day without realizing they're ignoring one of the most powerful tools for vascular health that exists. Stay with me, because what I'm about to share will change everything you think you know about natural enhancement. Hello everyone, I'm Dr. Charlotte Hayes, and today we're diving into something that combines ancient acupressure wisdom with modern vascular science. We're talking about specific pressure points that, when stimulated correctly, can open your blood vessels, enhance circulation to critical areas, and restore function in ways that seem almost miraculous. But there's nothing mystical about this. It's pure physiology, and the results are both immediate and cumulative. The primary spot I want to teach you about is located on your inner ankle, and it's been used in traditional medicine for thousands of years, specifically for male vitality and reproductive health. In acupressure, this point is called kidney 3 or Tai Chi, which translates to supreme stream. The name is fitting because this point has profound effects on blood flow and vascular function throughout your entire lower body, particularly to the pelvic region. Let me explain exactly what happens physiologically when you stimulate this point. The spot is located in a depression between your inner ankle bone and your Achilles tendon. When you press firmly into this area, you're stimulating several important structures simultaneously. First, you're affecting the posterior tibial artery and vein, major blood vessels that supply your lower leg and foot. The pressure creates a temporary restriction of blood flow, and when you release the pressure, there's a reactive hyperemia, which is a surge of blood flow that exceeds the normal baseline. But the effects go far beyond just local circulation. This pressure point is located along what traditional Chinese medicine calls the kidney meridian, an energetic pathway that connects to your entire urogenital system. While Western medicine doesn't recognize meridians in the traditional sense, we do recognize that stimulating specific points can trigger neurological reflexes that affect distant parts of the body through the autonomic nervous system. When you apply pressure to this ankle point, you're activating mechanoreceptors in the tissue that send signals through sensory nerves to your spinal cord and brain. These signals trigger reflexive responses in your autonomic nervous system, specifically enhancing parasympathetic activity. The parasympathetic nervous system is responsible for rest, digestion, and, importantly, arousal and firmness. Increased parasympathetic activity promotes vasodilation throughout your body, particularly in the pelvic region. Research using imaging technology has shown that stimulation of this specific acupressure point increases blood flow to the pelvic organs. One study using Doppler ultrasound found that acupressure at this location significantly increased blood velocity in the arteries supplying the pelvic region. The effects were measurable within minutes and lasted for several hours after the stimulation ended. Here's exactly how to stimulate this point for maximum benefit. Sit comfortably in a chair with your foot resting on your opposite knee, making your inner ankle easily accessible. Use your thumb to locate the depression between your inner ankle bone and your Achilles tendon. You'll know you found the right spot because there's a natural hollow there. And when you press into it, you'll feel a deep, slightly achy sensation that may radiate up your leg or down into your foot. Apply firm, steady pressure with your thumb. The pressure should be strong enough that you feel a deep sensation, but not so hard that it causes sharp pain. Think of it as a 7 out of 10 on a pressure scale. Hold this steady pressure for 30 seconds, then release for 10 seconds. Repeat this cycle 4 times for a total of 2 minutes per ankle. Always do both ankles, as the effects are bilateral and stimulating both sides creates more comprehensive vascular enhancement. The timing of when you do this matters. For immediate effects before anticipated activity, stimulate these points about 30 to 60 minutes beforehand. This gives your vascular system time to respond fully to the stimulation. For cumulative benefits, do this protocol twice daily once in the morning and once in the evening. Regular daily stimulation progressively improves your baseline vascular function over weeks and months. Now, let's talk about the second crucial pressure point, which is located on your lower abdomen. This point is called conception vessel 4 or guanyin, which translates to origin pass. It's located approximately 4 finger widths below your navel, right on your midline. This point has direct effects on your reproductive organs and the blood vessels that supply them. When you stimulate this abdominal point, you're creating mechanical pressure on the tissue overlying your bladder, prostate, and the complex network of blood vessels in your pelvis. This pressure has several effects. First, it stimulates blood flow in the inferior epigastric and pudendal arteries, which are the primary blood supplies to your pelvic organs. Second, it affects the hypogastric nerve plexus, a network of autonomic nerves that control function in your pelvic organs, including those responsible for firmness. The technique for this point is slightly different because of its location. Lie on your back in a comfortable position. Use 3 fingers of one hand placed horizontally to measure 4 finger widths down from your navel. Then use your index and middle fingers pressed together to apply pressure at that spot. Press firmly into your abdomen, angling the pressure slightly downward toward your pelvis rather than straight down into your belly. The pressure should be firm and sustained, but not painful. You might feel a deep, dull sensation that spreads through your lower abdomen and pelvis. This is normal and indicates you're stimulating the right area. Hold steady pressure for 45 seconds, release for 15 seconds, and repeat this cycle twice for a total of 2 minutes of stimulation. Many men report feeling increased warmth in their pelvic region during and after stimulating this point. Some describe a tingling or energized sensation. These sensations indicate that blood flow is increasing and that the autonomic nervous system is responding to the stimulation. Let's discuss the third important pressure point located on your lower back. This is the C of vitality point, which in acupressure terminology is actually a pair of points called bladder 23 and bladder 47. These points are located on either side of your spine at the level of your waist, approximately where your lowest ribs meet your spine. These points have powerful effects on kidney function, adrenal function, and sexual vitality. The kidneys and adrenal glands sit right in this area, and stimulating these points affects both the organs themselves and the extensive nerve networks that control pelvic function. The adrenal glands produce hormones, including those that affect arousal and stress response, and the nerves in this area connect directly to your pelvic organs. Accessing these points requires a specific position. Lie on your back on a firm surface like the floor with a yoga mat or carpet for comfort. Place your hands underneath your lower back with your palms facing down and your fingers pointing toward your buttocks. Your hands should be positioned so that your fingers naturally rest on the muscles on either side of your spine at waist level. Using your body weight, press down onto your hands, allowing your fingers to sink into the muscles on either side of your spine. You should feel firm pressure but not pain. Hold this position for 60 seconds, allowing your body weight to create steady, sustained pressure. Then lift your hips slightly to release the pressure for 20 seconds. Repeat this cycle once more for a total of 2 minutes of stimulation. An alternative method is to use tennis balls or acupressure balls. Place 2 balls on the floor about 3 to 4 inches apart. Lie down so the balls are positioned on either side of your spine at waist level and allow your body weight to create the pressure. This method allows for longer sustained pressure and can be more comfortable for extended sessions. Now, let's talk about the fourth pressure point, which is located on your foot. This is the liver 3-point, also called Tai Chong or Great Surge. It's located on the top of your foot in the depression between your big toe and second toe, about 2 finger widths back from where the toe bones meet the foot bones. This point affects the liver meridian, which in traditional medicine is closely connected to reproductive function and blood flow throughout the body. Stimulating this point has been shown to reduce stress, promote parasympathetic nervous system activity, and enhance circulation to the pelvic region. It's particularly effective for men whose functional difficulties are related to stress, tension, or excessive sympathetic nervous system activation. To stimulate this point, sit comfortably with your foot accessible. Use your thumb to locate the depression between your big toe and second toe bones. Press firmly into this depression, angling your pressure slightly toward your ankle rather than straight down. The pressure should create a deep, spreading sensation that might travel up your foot or into your toes. Hold firm pressure for 30 seconds, release for 10 seconds, and repeat 3 times on each foot for a total of 2 minutes per foot. Many men find that stimulating this point creates an immediate sense of relaxation and stress release, which indirectly supports better function by shifting the nervous system into the parasympathetic state that's necessary for arousal. Let's discuss the 5th pressure point, located on your inner thigh. This point is called spleen 6 or san jiao, meaning 3 yin intersection, because 3 different meridians converge at this location. It's positioned about 4 finger widths above your inner ankle bone, just behind your shin bone on the muscle of your inner leg. This point is considered one of the most important for male reproductive health and vitality. It affects blood flow to the pelvic region, supports hormonal balance, and enhances the function of your reproductive organs. Research has shown that stimulation of this point increases blood flow in the femoral artery, which branches to supply the pelvic region. To stimulate this point, sit with your leg accessible. Measure 4 finger widths up from your inner ankle bone. Then feel for the edge of your shin bone. The point is just behind the shin bone in the muscle. Press firmly into this area with your thumb, using enough pressure that you feel a deep, somewhat tender sensation. This tenderness is normal and indicates you found the correct location. Hold pressure for 30 seconds, release for 10 seconds, and repeat 4 times on each leg. The pressure should be sustained and firm throughout the hold period. Many men notice that this area feels quite sensitive or tender when first stimulating it. But with regular practice, the tenderness decreases as circulation improves. Now let's talk about creating a comprehensive pressure point protocol that combines multiple points for maximum synergistic effect. Circulation, and when APARA by I, YMPATHETIC, Ranchester Maids Nervert Cruise SYSTEM Ries, FOLOOWED, by a bid meant to demean her more than purchase her, the cumulative effect is far greater than stimulating any single point alone. A complete protocol would start with the liver, 3 points on both feet to initiate stress reduction and parasympathetic activation. Then move to the kidney, 3 points on both inner ankles to enhance circulation and trigger the vascular reflexes. Next, stimulate the spleen, 6 points on both inner thighs to further increase blood flow to the pelvic region. Follow with the lower abdominal point to directly affect pelvic organ circulation. Finally, finish with the lower back points to engage the nerve networks that control pelvic function. This complete protocol takes approximately 15 to 20 minutes and creates a powerful cascade of vascular and neurological effects that enhance function dramatically. Many men report that doing this full protocol creates effects that last for 12 to 24 hours, with progressive improvements in baseline function when done daily over weeks and months. For men who don't have time for the full protocol daily, alternating between different points on different days still provides significant benefits. Perhaps focus on the ankle and foot points on Monday, Wednesday, and Friday, and the abdominal and back points on Tuesday, Thursday, and Saturday. Even this alternating approach creates cumulative vascular benefits. The science behind why these pressure points work is becoming clearer as research continues. Modern studies using functional MRI have shown that acupressure stimulation activates specific areas of the brain, including those involved in autonomic nervous system control and pain modulation. The mechanical pressure on these specific points triggers nerve signals that travel to the spinal cord and brain, where they activate reflexive responses that affect distant parts of the body. There's also evidence that acupressure stimulation triggers the release of various neurochemicals, including endorphins, which provide pain relief and promote relaxation, and nitric oxide, which is the master molecule for vasodilation and firmness. The sustained pressure on these points appears to trigger local production of nitric oxide in the blood vessels, which then spreads systemically to enhance circulation throughout the body. The tissue response to repeated pressure also contributes to the cumulative benefits. When you regularly stimulate these points, you're creating repeated cycles of temporary ischemia followed by reperfusion. This process, called ischemic preconditioning, actually trains your blood vessels to be more responsive and to dilate more effectively. It's similar to the benefits of high-intensity interval training for cardiovascular health, but targeted specifically to vascular responsiveness. Let me address some important safety considerations. These pressure point techniques are safe for most men, but there are some situations where caution is warranted. If you have any blood clotting disorders or take blood thinning medications, consult with your healthcare provider before doing intensive pressure point work, as the pressure could theoretically affect clotting in unpredictable ways. If you have severe cardiovascular disease, particularly if you've had recent cardiac events, check with your cardiologist before starting these techniques. While the vascular effects are generally beneficial, any intervention that affects circulation should be discussed with your doctor if you have serious heart conditions. Start with moderate pressure and increase gradually as you become familiar with the techniques. Excessive pressure, especially initially, can cause bruising or tissue damage. The goal is firm, sustained pressure that creates a deep sensation, but not acute pain. The results from consistent pressure point practice can be remarkable. Most men notice some immediate effects after their first session, typically feeling increased warmth and circulation in the pelvic region. Within 1 to 2 weeks of daily practice, many men report noticeable improvements in firmness, quality, and ease of achieving response. By 4 to 8 weeks, the benefits typically become quite pronounced, with significant improvements in baseline function. The beauty of this approach is that it's completely natural, has no side effects, costs nothing, and can be done anywhere with complete privacy. You're using your body's own reflexive mechanisms to enhance circulation and function, not relying on external substances or interventions. Thanks for watching today. If you found this valuable, please subscribe for more evidence-based natural health strategies. Until next time, this is Dr. Charlotte Hayes reminding you that your body has incredible built-in mechanisms for healing and enhancement, and pressure point therapy is one of the most powerful tools for accessing those mechanisms.